You're watching Strange Reality, where we explore the strange, the hidden, and the unexplained mysteries of our world. Imagine being invited to a concert, a football game, or even just asked to walk through a busy shopping mall. For most people, it's no big deal. But for someone with agoraphobia, these situations can trigger overwhelming fear, panic, and the desperate need to escape. Today, we're exploring one of the most life-limiting phobias of all, agoraphobia, the fear of open or crowded spaces. Agoraphobia is more than just a fear of being outside. It's an anxiety disorder where people feel intense fear in situations where escape might be difficult or help might not be available if they have a panic attack. This could mean crowded places, open fields, public transport, or even just stepping outside their own home. It's estimated that about 1.3% of U.S. adults will experience agoraphobia at some point in their lives, and women are diagnosed nearly twice as often as men. The word agoraphobia comes from the Greek word agora, meaning marketplace, and phobos, meaning fear. Ancient marketplaces were busy, open spaces filled with people, exactly the kind of environment someone with agoraphobia would want to avoid. The condition was first formally described in the late 19th century, when doctors noticed patients avoiding public squares and large gatherings because of uncontrollable fear. Agoraphobia often develops after a series of panic attacks. The person starts to associate certain places with fear, and slowly their world begins to shrink. Common triggers include being in crowds or long lines, traveling on buses, trains, or airplanes, walking across wide-open areas like parking lots or parks, shopping malls, movie theaters, or stadiums. Symptoms can include racing heartbeat, dizziness, shortness of breath, trembling, chest pain, and an overwhelming urge to escape. Consider this. A young woman is invited to a wedding. She wants to go, but just the thought of being in a crowded reception hall fills her with dread. She pictures herself fainting, panicking, or not being able to leave when she needs to. To avoid the humiliation and fear, she cancels. Soon, she begins avoiding more and more events until she rarely leaves home at all. This is how agoraphobia quietly takes control of lives, by turning ordinary places into battlegrounds of fear. What causes agoraphobia? Experts believe it's a combination of factors. 1. Panic disorder. Many people develop agoraphobia after repeated panic attacks in public. 2. Trauma. Experiencing a frightening event in a crowded or open space can leave lasting fear. 3. Genetics. Having a family history of anxiety or phobias increases the risk. 4. Brain chemistry. Imbalances in how the brain regulates fear responses. The fear is not irrational to the person experiencing it. It's their brain's way of trying to protect them. Agoraphobia can be devastating. Some people are unable to work, attend school, or even visit friends and family. At its most severe, a person may become housebound, unable to step outside without overwhelming anxiety. Even simple tasks, like grocery shopping, going to a doctor's appointment, or taking a walk, can feel impossible. This isolation often leads to depression and worsens the cycle of fear. The good news is that with help, agoraphobia can be managed and even overcome. Common treatments include cognitive behavioral therapy, CBT, teaching people to challenge fearful thoughts and gradually face avoided situations. Exposure therapy, carefully introducing feared environments step by step. Medication, such as antidepressants or anti-anxiety medication to help stabilize symptoms. Support systems. Family, friends, and therapy groups make recovery less isolating. Virtual reality therapy is also becoming a powerful tool, allowing people to practice facing crowded or open spaces in a safe environment. It's important to understand, agoraphobia is not laziness, weakness, or a refusal to participate in life. It's a very real condition that traps people in their own home. By spreading awareness, we can replace judgment with compassion and isolation with support. Agoraphobia shows us how powerful the human mind can be, powerful enough to create barriers where none exist. But with the right help, those barriers can be broken. Until next time, stay curious, stay open-minded, and keep exploring the mysteries of the human mind. Remember to like, share, and subscribe to this channel.